Tonight, COVID-19 has magnified troubles within our nursing homes.
Absolutely. From the lack of qualified workers to infection control, and the government has tried to buy its way out of this problem. But Reveal investigator Rebecca Lindstrom is asking, who is actually holding these facilities accountable?
Lori Simonelli has waited 14 months for this moment, a chance to be outside with her mother Carol, listening to Frank Sinatra.
Hold my hand.
Simonelli moved her mom into Chestnut Ridge 2 years ago.
They had bingo, they had games, they had a beauty parlor.
You felt good about her being there?
Yes. And then it stopped.
What changed?
Everything.
Everything means COVID, temporary staff, and isolation. Her mom is wheelchair-bound and has dementia. In November, Chestnut Ridge reported its first positive resident.
All of a sudden, a week later, they have full patient involvement, full staff involvement.
According to the state, it actually took about 3 weeks. But yes, by December, just about every resident had tested positive, and staff were quick to follow. Even Simonelli's mom ended up at the hospital for 8 days.
She has COVID pneumonia in all lobes.
What's baffling to Simonelli is that just 1 month prior to the outbreak, Chestnut Ridge had received nearly $119,000 from the federal government. Bonus money for doing a good job protecting residents from the virus.
Yeah, it's very alarming. It's just alarming.
Last year, the U.S. Department of Health and Human Services gave more than $45 million in bonus money to 321 nursing homes in Georgia, even though 42 of them had received fines for safety violations that same year from the same federal agency.
What this pandemic has done is it's exposed the cracks within the long-term care system.
Some of the fines related directly to infection control. Rooms not properly disinfected, staff going in and out without washing their hands or wearing face masks. And in almost every case, the bonus money paid for those fines and then some.
It's just a total disservice, slap in the face, gut punch, whatever euphemism you want to use, to the residents who have already suffered so much this pandemic.
But HHS defends the payment, saying in part, nursing homes have been disproportionately impacted by this pandemic, given their congregate nature and increased challenges of controlling infections. Inspectors found no problems with infection control at Chestnut Ridge when they visited in July, August, November, and January.
Look at the sky. I know, it's beautiful.
Still, Simonelli is keeping a watchful eye over her mother's care. She hopes things return to the way they were.
Nothing but blue skies. Do I see?
Nothing but blue skies from now on.
To learn more about this investigation and many other stories our team of investigators are working on, just click on the Reveal tab on 11alive.com.